Experience the power of breath with Spiriva, a revolutionary medication that is transforming the way we manage lung health. Spiriva is designed to improve lung function and breathing capacity, helping individuals with chronic obstructive pulmonary disease, COPD, breathe easier and live a fuller life. With its innovative delivery system, Spiriva provides long-lasting relief by targeting the root causes of airflow limitation. Each dose of Spiriva is packed with tiotropium, a bronchodilator that works to relax and open up the airways, reducing symptoms like wheezing, shortness of breath, and coughing. But Spiriva is more than just a medication. It is a game-changer for individuals battling COPD, offering a breath of fresh air in their daily lives. By incorporating Spiriva into their treatment plan, patients can experience improved lung function, reduced exacerbations, and enhanced quality of life. Don't let COPD limit your potential. Discover the power of breath and experience true freedom with Spiriva. Start breathing easier today and embrace a brighter, healthier future. Understanding lung health. To truly appreciate the impact of Spiriva in managing lung conditions, it is essential to understand the importance of lung health. The lungs are vital organs responsible for exchanging oxygen and carbon dioxide in the body. However, various factors, such as smoking, pollution, and genetic predisposition, can lead to the development of lung diseases like COPD. COPD is a progressive lung condition characterized by airflow limitation, making it difficult for individuals to breathe. Symptoms include persistent coughing, wheezing, shortness of breath, and chest tightness. Without proper management, COPD can significantly impact an individual's quality of life and increase the risk of exacerbations and complications. The role of Spiriva in managing lung conditions. Spiriva plays a crucial role in managing lung conditions, especially COPD. It belongs to a class of medications known as long-acting anticholinergics, which work by relaxing and opening up the airways. This allows for improved airflow and reduces the symptoms associated with COPD, such as wheezing and shortness of breath. Unlike short-acting bronchodilators, which provide temporary relief, Spiriva offers long-lasting benefits. It is designed to be taken once daily, providing consistent and continuous bronchodilation throughout the day and night. This allows individuals to breathe easier and engage in daily activities without the constant burden of breathlessness. Benefits of using Spiriva. Incorporating Spiriva into a treatment plan for COPD offers numerous benefits for individuals battling this chronic lung condition. One of the primary advantages is improved lung function. Spiriva helps to relax and open up the airways, allowing for easier breathing and better oxygen exchange. This can lead to increased exercise tolerance and improved overall respiratory health. Another significant benefit of using Spiriva is a reduction in exacerbations. Exacerbations refer to episodes of worsening symptoms, often triggered by respiratory infections or environmental factors. By keeping the airways open and reducing inflammation, Spiriva can help prevent exacerbations and minimize the need for additional medications or hospitalizations. Additionally, Spiriva can enhance the quality of life for individuals with COPD. Breathlessness is a common symptom that can limit daily activities and impact overall well-being. By providing consistent and long-lasting bronchodilation, Spiriva allows individuals to engage in physical activities, socialize, and pursue their passions without the constant worry of breathlessness. How Spiriva works in the body. Spiriva contains the active ingredient tiotropium, which is a long-acting bronchodilator. When inhaled, tiotropium binds to specific receptors in the airway's smooth muscles, blocking the action of acetylcholine, a neurotransmitter that causes bronchoconstriction. By inhibiting this process, Spiriva helps to relax and open up the airways, improving airflow and reducing symptoms. The unique formulation of Spiriva ensures that the medication reaches the targeted areas of the lungs effectively. The inhaler device delivers a pre-measured dose of the medication in a slow and controlled manner, allowing for optimal distribution and absorption in the airways. This ensures that the medication remains active for an extended period, providing long-lasting relief. Spiriva dosage and administration. Spiriva is available in an inhalation powder form, and the recommended dosage is 1 capsule per day. The capsule is to be used with the Spiriva HandiHaler device, which is specifically designed for easy and effective administration. The HandiHaler device allows individuals to inhale the medication by activating the device and breathing in slowly and deeply. It is important to follow the instructions provided by the healthcare professional for proper usage of Spiriva. The capsule should not be swallowed and should only be used with the designated inhaler device. If any difficulties or concerns arise during administration, it is essential to consult a healthcare professional for guidance and support. Common side effects of Spiriva. Like any medication, Spiriva may cause side effects in some individuals. However, it is important to note that not everyone will experience these side effects, and they are generally well tolerated. The most common side effects of Spiriva include dry mouth, throat irritation, constipation, and urinary tract infections. Dry mouth is a common side effect that can be managed by staying hydrated and practicing good oral hygiene. Throat irritation can be alleviated by drinking water or using throat lozenges. Constipation can be addressed by ensuring an adequate intake of fluids and fiber-rich foods. If any side effects persist or become bothersome, it is advisable to consult a healthcare professional for further guidance. Precautions and considerations when using Spiriva. While Spiriva is generally safe and effective, there are certain precautions and considerations to keep in mind when using this medication. It is essential to inform the healthcare professional about any existing medical conditions, allergies, or medications being taken, as they may interact with Spiriva. Individuals with a known allergy to tiotropium or any of the components of a Spiriva should not use this medication. It is also important to disclose any history of glaucoma, urinary retention, or other medical conditions that may be affected by the use of anticholinergic medications. If Spiriva is prescribed during pregnancy or while breastfeeding, it is important to discuss the potential risks and benefits with the healthcare professional. They can provide guidance and support in making an informed decision regarding the use of Spiriva in these situations. Frequently asked questions about Spiriva. Can Spiriva be used as a rescue inhaler? No, Spiriva is not meant to be used as a rescue inhaler. It is a long-acting medication that provides continuous bronchodilation and should be taken once daily as prescribed. For immediate relief of symptoms, individuals should use their prescribed short-acting bronchodilators. Can Spiriva be used by children? Spiriva is not approved for use in children under the age of 18. The safety and effectiveness of Spiriva in pediatric populations have not been established. Is Spiriva addictive? No, Spiriva is not addictive. It is a medication that helps to manage symptoms and improve lung function in individuals with COPD. Can Spiriva be used with other medications? Spiriva can be used with other medications prescribed for COPD, such as short-acting bronchodilators or inhaled corticosteroids. However, it is important to inform the healthcare professional about all medications being taken to ensure there are no potential interactions. Conclusion: embracing a breath of fresh air with Spiriva. In conclusion, Spiriva is a game changer in the management of lung conditions, particularly COPD. By providing long-lasting relief and improving lung function, Spiriva offers individuals the opportunity to breathe easier and live a fuller life. With its innovative delivery system and proven benefits, Spiriva is a powerful tool in the fight against COPD. If you or a loved one is living with COPD, don't let the symptoms limit your potential. Discover the power of breath and experience true freedom with Spiriva. Consult a healthcare professional to determine if Spiriva is suitable for your specific needs, and start breathing easier today. Embrace a brighter, healthier future with Spiriva and unlock the full potential of your breath. Thanks for watching.